This is America in shutdown, day 21. Well, tonight, as Christians begin Holy Week and as Jews prepare to celebrate the Passover, we are all acutely aware of the darkness that this COVID-19 crisis has wrought. The more than 10,000 Americans who've now lost their lives, and countless more have had their lives upended. Businesses frozen, parents frustrated, children are just confused, and workers unemployed. But there are some, and we needed these hopeful signs emerging. Now, while New York is still suffering greatly with its more than 4,700 COVID deaths, the daily numbers are actually stabilizing, and there are other positive signs.
Total number of hospitalizations are down, the ICU admissions are down, and the daily intubations are down. Those are all good signs, and again would suggest a possible flattening of the curve.
Earlier than some people thought, perhaps we'll be watching. While the West Coast is far ahead of New York in the good news category, things are looking up in the fight against COVID, both in Washington state and in California. Now, some states are just doing such a good job at budgeting and reallocating their own resources that they're able to share some of their medical equipment. Governor Jay Inslee, a Democrat, announced Sunday that Washington state will be returning more than 400 ventilators that it received from the Strategic National Stockpile, so they can then be transferred to other states. And on Saturday, Oregon's Governor Kate Brown, she announced that her state can afford to share 140 ventilators with New York.
You look at most places where that, you can call it the bump, you can call it the hill, you can call it the mountain, you can call it whatever you want to do it. It's very flat. You have a couple of tough ones. New Jersey's been very tough and New York has been very tough. You look at so many of these states, how well they're doing.
Well, that's good to hear. And like you, I'm wondering, when do we get our country back?
Will we truly get back to normal in this country before there's an actual vaccine that's available to everybody?
If back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. When we get back to normal, we will go back gradually to the point where we can function as a society. I mean, if you want to get to pre-coronavirus, that might not ever happen.
Well, the president didn't seem like he was completely thrilled with that answer.
I think we can get more than back to normal from an economic standpoint, actually be better, but more than back to normal. But I would agree that we'd love to see a vaccine, but immediately would love to see a therapeutic. And I think we're getting very close.
Now, speaking of therapeutics, some in the media and the medical establishment, as I mentioned to Sean, continue this bizarre assault on the decades-old drug hydroxychloroquine that's being used by doctors worldwide, and I mean worldwide, to treat COVID patients, especially seeing promise in early interventions. Now, to get a sense of how political the criticism has become, check this out.
We're focusing so much on hydroxychloroquine, we're overlooking all the really important social issues that are not being mentioned. We're not talking about the spike in domestic violence that's being seen by people, being forced to stay inside. We're not talking about the impact on indigenous and undocumented communities all throughout the U.S. And we're not talking enough about the impact of coronavirus on people of color.
Well, not to say those aren't all important issues, they are, but you can talk about all of those things, can we not? And what he didn't say is that the hydroxy plus azithromycin is now being used by physicians treating COVID patients in his own hospital. I know, because I've spoken to the doctors. Now, I'll say what I say almost every day. If at all possible, short of a vaccine, we need a cheap, scalable therapeutic. But remember, the drug companies, they don't make their real money off old generic drugs. No, no. So far, we have a controlled study in China, albeit on the small side. We have a study by one of Europe's top epidemiologists, Didier Raoult, and we have observational data from around the globe that shows that hydroxy and azithro can drop a COVID patient's viral load and send them home from the hospital. So they drop the viral load, they will not shed that virus as much as they would without it. Now, Andrew Cuomo is even seeing the promise.
We've allowed usage of the hydroxychloroquine with the azithromycin packs pack in hospitals at their discretion. The federal government is going to increase the supply to New York pharmacies. There has been anecdotal evidence that it is promising. That's why we're going ahead. Doctors have to prescribe it. Anecdotally, it's been positive.
Well, another hot spot is acknowledging the benefits as well.
These drugs don't represent a silver bullet or a magic wand. However, many medical doctors have chosen to prescribe these drugs to relieve symptoms of the virus in some patients. Positive results in a patient by these drugs could potentially allow our ventilator needs to decrease.
Of course, that's the LA Attorney General, Louisiana Attorney General. Well, of course, nothing short of a vaccine is a magic wand, but the drugs can relieve pressure on the hospitals and the ICUs, helping us to avert a total collapse of our healthcare system, which was the whole point of flattening the curve in the first place, saving patients and saving the hospitals. Now, finally, there's an interesting new poll by Just the News Polling and Scott Rasmussen on what worries Americans most about the crisis. 30% of Americans say the most difficult impact has been on their loss of income. 27% cite finding supplies. 23% chose isolation and boredom. Only 4% of Americans cited their health as their top concern. Now, I was thinking about that. I think people are just pragmatic. They know there are risks to walking out the door every day. They want to be careful. They want to be, have common sense. But they know that we must protect the vulnerable, including healthcare workers, first responders. They get all that. Yet they also know that this situation of being locked in, shut in, is just not sustainable. They know that every day we're in shutdown is another day of self-inflicted, devastating wounds to American families and to our country as a whole.
We want to finish this war. We have to get back to work. We don't want to be doing this for months and months and months. We're going to open our country again. This country wasn't meant for this, but we have to open our country again.
We need an American resurrection, sooner rather than later. And those are my thoughts at the end of day 21, America in shutdown.